In today's Innovation in Medicine, we're learning about a new scan that's making a big difference when it comes to the early detection of lung cancer. I'm here with Dr. DeCamp. And Doctor, what this is a low-dose CT scan. So let's talk about what that is exactly and how it works.
Sure, a low-dose CT scan takes about 30 seconds to obtain images all the way through the chest so that we can reconstruct them and look at every 3 millimeters of the lung. So if you're a small nodule in the lung, it's hard to hide.
Take a deep breath in and hold it.
By using a lower dose than we would for a standard CT scan, we're making it safer. So something that you could have on a more regular basis, say once a year.
And that's important because people who are smokers or even former smokers are at higher risk for lung cancer.
So we've known for a long time that smoking is the major risk factor for lung cancer, but we just haven't had a good tool to look at those patients at risk.
You may breathe.
That's it, he's done.
Used in this higher risk population, this finds lung cancer at an early stage. And if you find lung cancer at an early stage, it's easier to treat.
Why is this innovation so important?
Well, lung cancer is the #1 cancer killer of women and men. It kills more people than breast cancer, colon cancer, prostate cancer, pancreas cancer added together. If we can triple the survivability of lung cancer, it's going to benefit way more people in the near term. And there are things you can do. Of course, you can never smoke or you can stop smoking, but if you already have incurred that risk, then early detection is the best medicine, if you will.
That message really resonates with former smoker Fred Shapiro.
All right, Fred, that's it, honey. You're on it.
I started smoking, and I kept at it 2 to 3 packs a day for 30 years. I quit in '97.
One day, Fred found himself coughing up blood. His doctor sent him to get screened using this technology, which immediately found the problem.
He had a biopsy and it did demonstrate that he had a form of lung cancer called squamous cell lung cancer, the second most common kind that we take care of these days.
When I found out that there was something there, I was shocked. I mean, there was just an assumption if I had cancer, I would feel worse than this.
Physiology is more important, that's how we live. You know, how well does that lung work?
At this point, I was fairly nervous, panicked, scared, fearful, despairing, pick your word.
The good news was that Fred's cancer was caught at an early stage, and doctors could get rid of the cancer by removing 2 lobes of his lung.
2 days after I got home, Dr. DeCamp called me and said, Fred, you're done. No radiation, no chemo. Your lymph nodes all came back clear, you're cured.
That meant Fred could stop worrying about cancer and focus on his favorite hobby.
And I really just love cycling. And you're moving and you're balanced and it's effortless. It's like you're floating. Kind of a nice thing to do. I can think clearly when I'm cycling. So it's the thing I like doing. I feel just like I did before. I feel great. Only this time I don't have cancer, which is huge.
Even though we took out 2/3 of his right lung, he's very fit and functional. He's a real motivation to his peers.
And there's really no reason not to do it. They don't give you a lollipop afterwards. But other than that, it's painless and it's just something you want to do.
To learn about other innovations in medicine, head to our website, livinghealthytv.com.
After the break, what can you do to kick the unhealthy habit of smoking and stick with it?
The most important thing to do is make a commitment to quit.
And we're recapping all the great advice we got today on Living Healthy.